Felicia Ashley brings us the latest in her series of reports on failures at Cedar Hill Hospital.
The hospital opened last April, and it was supposed to bring much-needed medical care to an underserved community. Cedar Hill has fallen short in almost every measurable way.
And now, as Felicia reports, the D.C. Department of Health has slapped the hospital with a citation for dangerous levels of noncompliance.
I've been uncovering serious issues inside of the Cedar Hill Regional Medical Center since shortly after it first opened to the public last fall. In February, I interviewed a former Cedar Hill employee exposing safety and staffing issues. It led to a flood of calls and messages from other Cedar Hill employees who wanted to speak up. It started a firestorm inside of the hospital.
It was bad.
What was bad?
Everybody talked about it. It was emails going out, not to talk to the media.
This is that interview with former Cedar Hill ER tech Jerzaine Hernandez from February. He revealed the hospital had to stop taking in patients due to safety issues multiple times, including just a month after it opened.
A lot of people was happy that he told the truth.
One of those employees reached out after that interview for a sit-down, as long as we didn't share their identity, for fear there could be consequences from the hospital administration. You mentioned that they gave these warnings and threats essentially to not share what's going on inside. What made you passionate to still want to?
Because I care, and I'm angry. What I'm seeing happening in that hospital, I'm very angry. You have people in and out that place. It's like a revolving door. You have like contractor nurses that they leave, they don't come back. Right now we have no x-ray techs. Everybody left. So they had to hire in a contract company. Nobody can do x-rays. That's unacceptable.
The circumstances they describe are serious and raise significant questions about patient care. Then 7 News obtained this copy of a mandatory surgical operative procedure change I'm told was sent to employees. It reveals the hospital received something called a citation of immediate jeopardy from the Department of Health, which is as bad as it sounds. Have you ever worked at a hospital that got an immediate jeopardy?
No, I've never worked in a hospital. It's never like this before. And it's really concerning. It's really uncomfortable. Coming into work not knowing if the next patient gonna die. It's bad. It's bad. It's bad.
The immediate jeopardy notice reflects what the Department of Health defines as the highest level of noncompliance. The memo states the Department of Health found deficiencies in surgical scheduling.
A citation of jeopardy says, don't go. And that's sad, because where are they gonna go?
Dr. Marilyn McPherson was chief of staff at United Medical Center and owns her own medical practice in Northwest D.C. Along with other community doctors, she's been in talks with Cedar Hill leadership on needed improvements. How often are immediate jeopardy citations given to hospitals? Is it frequently?
This is the first. I've been in practice 45 years.
Ambrose Lane is chairman of the D.C. Health Alliance Network, the largest community-based health and policy advocacy group in D.C.
When it's failure, it does represent failure.
The Department of Health issued the IJ for the Centers of Medicare and Medicaid Services. It means a healthcare facility's noncompliance has placed the health and safety of patients at risk for serious injury, harm, impairment, or death. The internal memo from Cedar Hill listed 4 requirements to get the hospital back in compliance. Case classifications must be accurate. Escalation must occur without delay. Documentation must be completed in real time. All required notifications must be documented. What does that tell you about what is or isn't happening inside Cedar Hill?
Well, it's clear in that memo that the documentation, there are issues.
That tells the whole story, because we're talking about George Washington University and Universal Health Services and the type of reputation that was purported that they had in treating patients. And they were supposed to bring that expertise east of the river. And when you have something like that, that shows that they missed something.
And there's a lot of times I go home and I'm shedding tears because there's nothing I can do about it. I'm so disappointed, but I care. And I'm gonna stay because I care. And I hope that things get better.
I reached out to Universal Health Services as well as GW University Hospital multiple times. They were open to speaking to me about a positive birthing experience it said it had at the hospital, but would not respond in terms of talking to me about the hospital overall or patient safety. I also reached out to the Department of Health to ask why it issued this immediate jeopardy, and it would not provide any further details. But since my last report, multiple staff members tell me that they've noticed an increased presence of management on campus as well as multiple changes in protocol. Now, I'm going to continue following up on this story and pushing to find out what changes are being worked on and what's going to be done to improve this hospital, which is the only hospital available to communities east of the river. For now, reporting from the DC Bureau, Felicia Ashley, 7 News.
After 7 News repeatedly pressed for answers, the hospital contacted us and confirmed it did receive an immediate jeopardy citation in February. It claims it made the mandatory corrections and ongoing monitoring plans. 7 News was also told by a source that the hospital allegedly received the citation due to the death of a young female patient. We directly asked the Department of Health about it. We were told it's still under investigation.